Hi everyone, today I have here with me Shelly. How are you, Sheldon?
I'm good.
It's a privilege to have you here.
Perfect. It's good to be here.
Oh, well, I want to say that he traveled from Florida. How much time it takes?
It takes about an hour and a half to get here from Naples, Florida. We fly out of Fort Myers. It comes directly to Cancun, and the whole trip is maybe an hour and 35 minutes.
So we're pretty close. And he came here because you had a broken tooth, no?
I had a broken tooth. It was actually the root was broken, and my local dentist in Naples, he fixed it, and he told me, Shelly, it's going to have to come out, and he sent the X-rays to Doctor German, and eventually the tooth did come out, and so here I am.
I have been knowing Sheldon and his lovely wife Maria for almost 7 years.
Easy 7 years.
8 years, and Maria came here. We did the implants on her, and dental work, and she's doing fantastic.
Absolutely.
She's doing fantastic, and that's why now Shelly come to visit us. The cool thing about this is that obviously he came here. He flew here on Friday. Well, it was Thursday, and you arrived here to the office on Friday, or did you arrive on Friday?
No, we left on Friday morning.
Yeah.
And we got here around 4 o'clock in the afternoon.
So we were placing an implant on Friday afternoon, and he was a little nervous, like, am I gonna be in pain? Am I gonna be on a sweating or whatever? And I think everything went just right, like nothing happened, no?
Like I didn't know what to expect, to be very frank. And I thought I'd be under the gun for about 2 hours. By the time Dr. German got through with me, it was maybe a half hour, and I have absolutely no pain, no discomfort, no nothing. I would tell you I have more discomfort when I used to have hair and I got a haircut and it went down your back, but I had zero. It was a pleasurable experience, absolutely pleasurable.
What we did is this, the technical part. It's like we had a broken tooth. This one was a broken tooth that probably, see, we have a broken post. So if you're asking if I have a broken crown, what should I do, if it's complex, if it takes time, or what can we do? One of the options, thank God, right now is that we can extract a tooth and we can place an immediate setting of an implant. Some doctors, they say, no, you cannot do it. Some doctors, they say you can. Well, one of the things to remember is that we have a cone that is the root that you have from your tooth. The implant doesn't have that shape. It's a different shape, and it has cords. So we have primary stability. Primary stability is one of the most important things. Once we extract that tooth, now we drill in a different position. It's like a 3D. We work in a different position, and that's why we're able to place an implant. So we have amazing cords. We can place an implant. The only thing here is we have the implant set. There we have the implant set. The implant is set parallel to the other tooth, and then what we do is that we place a crown. The implant is bone level, and it took us like 15 minutes, 20 minutes to place it in. So this is a very normal thing about patients, about if should I restore one tooth or should I get an implant. Now, he has a flipper right now because obviously you need to look really good. And just give me after 3 months. Some doctors, they say 3-6 months. Their recommendation is at least 3 months. Do not load the implant. Let the body do its work. The osseointegration of the body to that implant, it's very important. So after 3 months, what we do is that we remove the healing cap we have here, we take it out, and now we take an impression and we put an abutment and a crown, and you're all set. Let's say that someday you need to do something about this bridge, we can do the same thing. If you have any problem, we can do another implant there. Let's say just in case. But if you're thinking, should I remove the tooth and wait, and what am I going to do? This is a great solution. An extraction and an implant setting. That's important. And we did that on Friday afternoon. And how was your Saturday? I mean, 12 hours after?
12 hours after, I was fine enough to go and play racquetball to that.
We went on Sunday morning to play some racquetball. I like racquetball, and he's a pro on racquetball, so we went to play some racquetball. So imagine there's no discomfort, there was no swelling, like if nothing happened. Huh?
Absolutely, absolutely. No discomfort. I don't know what to tell you. It was just an experience that went beyond my dreams.
That's good. And what we have right now is that we have stitches that they're gonna dissolve by themselves 2 or 3 weeks. So they're gonna just dissolve and just let it heal. Let it heal. Use your flipper, and I'll be willing to see you within 3 months at least. Or if some patients that say, but I cannot go back in 3 months. Whenever you wanna make it back, it's okay, there's no problem. I even have patients that they come here and they cannot make it back because whatever. Remember that we use the same materials they use back home, and I only use the same materials that they use back home. I always say it on my videos because our country, it's a beautiful country, but it's a poor country. We don't produce nothing, so everything's imported. What I do is that I import everything also from the States, also Germany. So all doctors, we use the same brands. So there's no problem with that. But I know that you're gonna come because we're gonna play more racquetball. That's important. And one of the things that I want to tell you also is that when we're doing implants, we also have the primary stability. Imagine that with your fingers, because this is important. When we put an implant, let's say that we tied it real strong, it's only 5 newtons. What we can do with our fingers, with our hand. This implant is torqued 35 newtons. So imagine how strong it is. That gives us our primary stability, and then what we do is that we just uncover it. So that primary stability, it's an amazing thing that we have of biomaterials. We are on the bionic era. Remember Steve Austin?
Absolutely.
The bionic era. That's where we are. This is an amazing thing, biocompatibility. One of the best implants. You have one of the best implants here set, and of the brands. It's a beautiful brand that we work with. We work with many brands, and we just need to wait. And I hope to see you in at least 3 months.
As long as I can walk and talk, I'll be here.
I'll be here. What can you say about pricing? Comparison between back home and here?
Compared to back home, back here, it's about half the price.
Half the price, nice.
You more than cover your expenses. Mexico, it's a beautiful country, but things are not as expensive as they are back home. So even with your meals and your hotel and the doctor's expense, it might come out even with back home, but you're getting a vacation out of it. And that's what my wife and I do. We come here for vacation. We see the doctor, and we enjoy Mexico.
What can you say about Cancun? Because you have been several times here.
Cancun's a paradise. It truly is. It's a beautiful, beautiful.
You also live in paradise in Florida, but Cancun is a different story. No?
Cancun is different. It's a much more laid-back, friendly atmosphere than Naples, Florida. Florida is a pretty hectic environment. If we didn't have our grandchildren back home, Maria and I would be living here in Cancun.
Wow.
My wife is Mexican, and I've been coming to Mexico for as long as we've been married, which is forever. And if it was up to us, we'd live here. But you know, when you have grandchildren,
yes, you need to be there.
You got to be there.
So big hugs to Florida, and thank you for sharing your experience about placing one implant here.
Thank you for being here. It's an important part of my life right now.
Thank you. Now you have friends. Well, we have been in touch together for like around 8 years, but this is the first time that I see you, placing an implant, doing a surgical procedure and all that. We have been meeting together, but not in a surgical procedure. So I'm so glad. I feel really blessed that everything it's good with you and with your procedure.
It's like coming home to family here.
Thank you. You have family here.
Thank you so much, Doc.
Thank you for sharing. Big hugs to Florida, and thank you for watching, for seeing our videos, giving us your likes in our social media. Here we are in sunny Cancun. I'm Dr. Arzate. Thanks, Sheldon.
Thank you for me.
Thank you. Thanks, everyone. Bye.
Thank you.